Malaysia has secured more than 18 million doses of Russia's Sputnik V and China's Sinovac coronavirus vaccines. The deals come as the Health Ministry takes steps to ease the tremendous load on frontline medical workers. The plan includes sharing resources with private hospitals as the pandemic worsens, as Melissa Go reports.
33-year-old businessman Indra Putra Damrin has just spent 10 days recovering from COVID-19 at a temporary quarantine and treatment centre called Maips outside Kuala Lumpur. He's now back home with his family. He's thankful to those who looked after him while he was treated.
Kalau orang kata frontliners dah burn out, saya nampak situasi itu. Mereka bekerja round the clock, 24/7. Doctors, staff nurse, APM, pegawai polis, ramai lagi macam pihak catering, pihak sajen yang memberikan makanan. Nasihat kepada semua pesakit-pesakit yang masih lagi dikuarantinkan, berilah kerjasama yang terbaik kepada mereka. Mereka dah cukup terbeban dengan kerja dengan tugasan yang sedia ada. Janganlah kita tambahkan lagi beban tugasan mereka.
Many healthcare workers have been at the front line battling the pandemic for more than a year. The number of cases skyrocketed after a state election in East Malaysian state of Sabah last September, putting tremendous stress on the public healthcare system. Earlier this month, the Health Director General warned that the system is at a breaking point, with daily cases breaching 4,000 after travel restrictions were eased in December. Although the movement control order has since been reinstated, the worsening pandemic has already taken a heavy physical and mental toll on healthcare workers. Health Director General Dr. Noor Hisham has promised to ease their load and urged those suffering from emotional stress to reach out to support groups.
Ini cabaran kita di Kementerian Kesihatan dan bukan mudah, tetapi kita kena berperang, tak ada cara lain, tapi inilah yang kita kena silih berganti petugas-petugas di barisan hadapan.
Now, Dr. Noor Hisham says 95 private hospitals have agreed to join the ministry's efforts in combating the pandemic by sharing their resources and assets. Now, this has added another 1,300 beds, including 65 in intensive care units. A unified command centre has been set up to coordinate efforts and responses.
Under the emergency ordinance for COVID-19, so we have already override in terms of the APC, annual practicing certificate. You only designated where are you going to practice. So now healthcare professional can work in public sector and can be mobilized to the private sector and from one hospital to another.
But healthcare experts like Dr. Koh Swee King says more needs to be done, including improving the welfare and existing working conditions of frontliners.
The Ministry of Health will also need to embark on a long-awaited public-private partnership, bringing in laboratories, reagent manufacturers, and various other private sector entities to have a truly whole-of-society approach, which then must be integrated into a joint database, which then feeds information into our contact tracing system.
The government has topped up the monthly allowances of all frontliners until the pandemic ends. Some 500,000 frontliners will receive their vaccine when the first batch arrives at the end of February. Melissa Go, CNA, Kuala Lumpur.